Welcome to the ADS podcast. For 20 years, we've been the go-to dental practice for cosmetic and comprehensive dentistry in Atlanta. Our mission? Well, we've always led to create an exceptional dental experience through comfort, compassion, and expertise. Today, I'm sitting here with my partner, Dr. Shiven Gandhi, who leads the Virginia Highlands location. And we're gonna start this pod slow, Doc. We're gonna go in slow, I want you here because I scraped the web, spent all day looking for what are the top 10 dental confusions. Okay, so you and I are gonna have a dialogue about misconceptions because this podcast is forward-facing to the consumer, right? I think the more you can expose and talk about modern dentistry, the better, because dentistry, as we all know, scary place for a lot of people, right? So this is going to the consumer, not the dentist. Okay, welcome. You ready?
Let's do it.
Okay. All right. So how often should I be getting a dental checkup?
Patients should be getting a dental checkup at least every 6 months.
Okay.
If you haven't been to the dentist in a while, you should definitely.
So what's the reason? Like, why do you need to have we hear the ADA says that, but like, what is the reason? It's because you hear of other people who've like, I've been to the dentist in 10 years and everything's okay. But so why is every 6 months?
So just taking a step back, oral health is connected to the rest of the body. So we know that bacteria linger in the body in different places. And we know that there's a high correlation between bacteria found in the mouth that are also found in other areas of the body, like the heart, and are associated with pretty significant diseases and things. So taking care of the body also means taking care of the mouth.
Right.
And so I think a lot of people don't realize that. There's also people that don't go to a physician at all regularly. And they may come to the dentist first because they may have a toothache or a tooth problem. And then we have to have that conversation as healthcare providers and say, hey, listen, we're really glad that you're here. It's been a while, but we think there may also be some other things going on. Right. We need you to go and see another doctor.
So it's a prevention thing versus like, let's say something lingers, right? And meaning people think they can do the same job at home. Well, I haven't been in 10 years, when in actuality, we know, statistically speaking and scientifically speaking, that's not accurate. Right. You may have, quote unquote, gotten by, but you really are not optimizing your health. Really, if you don't have a healthy and pristine mouth, it's almost impossible to have a systemic health throughout your body, right? Is that kind of, so the x-rays, the checkups, I actually know some people who have made that connection, Doc, between their mouth and their body, either through their physician, that they come in and do every 3 months kind of thing, right? Yeah. Because the professional cleaning is just that. Okay, so this is going to get a little spicy. We'll get a little bit spicier. That was kind of a boring intro. All right, so what are the best ways to practice oral hygiene at home? Can I take this one, actually?
Yeah, go for it.
So my kids ask, of course, with having children and being a dentist, I have to kind of impart these things with my kids. And it's always like, did you brush your teeth? Did you brush your teeth? And so there's an analogy that works really well. And you can be the smartest person at the dinner table. And I use this acronym, FBI. And so I actually ask my kids, I just say FBI. And so what FBI, and I think that's the at-home best protocol. So what FBI stands for is first you floss, then you brush, and then you irrigate with like a water pick. And I think that's the gold standard for at-home treatment, right? Personally, and I'd like to hear, what you would say about that. And actually, Sharisa, our hygienist, gave me that acronym, and she's like, this is kind of the way, easy to remember, because I was like, brush first or brush second, or floss first, floss second. Which one? What's the order? And she was like, just remember FBI.
Yeah, no, that's absolutely correct. And it's funny. I actually get asked that question a lot. It's like, should I brush first or floss first? And there'll be like debates within our friends groups. And no, it's absolutely, you want to floss first because you want to disrupt what's between the teeth, and then you want to brush it away, and then you want to get the pressure washer out. You want to get the water pick. I love it. And then go in through with that. So
there's nothing more gratifying than pressure washing if you haven't done it.
Absolutely.
All right. Number three, rather. How can I improve the whiteness of my teeth?
Yeah. So there's a couple different ways, but what we typically recommend is teeth whitening.
Right.
So we have two different main options. We have in-office treatment, which lasts a couple hours, and we usually do 1 to 2 of those sessions.
Why can't someone just go get that at the store? They see the whitening.
Yeah, so there are a lot of products out there, and unfortunately, a lot of them end up just being kind of gimmicky, and they produce false positive white teeth. Like I've seen some of those purple solutions where it uses like an ultraviolet type color, where it manipulates light, and so it makes the teeth look brighter. But in reality, it didn't really do anything.
And the whitening gels that they sell at like a CVS are by law, they have to be much less powerful.
Much less powerful.
Yeah.
So anything that we can offer in a professional setting, we can do it more like a prescription. And make sure that it's done correctly and controlled, and there's not gel just going everywhere all over their mouth. And
I think this is a good time too to talk about, because I get the whole whitening toothpaste. I want you to talk about that in the context of usually how toothpaste whiten your teeth. And it's not by the way in which it's actually not in the way which you just described with a solution and like whitening gels. It doesn't have a whitening agent in it. Can you expand on why that could be potentially dangerous?
Yes. So it's funny. I had this conversation this week. Somebody was saying that they use whitening toothpaste, and I said, listen, your enamel is already, we're seeing some effects of wear on your enamel. Are you using a whitening toothpaste? Oh, yes, I'm using something like this. Okay, well, whitening toothpastes actually have more abrasiveness, which causes, it helps remove stains, but that also can adversely affect the teeth if we're not careful.
Well, how thick is let's just say on your front tooth, like how thick is your enamel in that area?
So on the front tooth, very center spot, the enamel is probably about 1 millimeter.
So 1 millimeter, right?
Thick, maybe a little bit more.
So to give people a context of what 1 millimeter is, like, what's the average thickness of something that's 1 millimeter?
So maybe like a handful of business cards, like two or three business cards.
Okay. So if that's all you're given at birth, right, is that, and then you take something that says super whitening, which I'm sure it's eye level at CVS because they want you to buy it, right? The abrasivity, right? There's a chart that goes over this. It is essentially like using sandpaper. Did it achieve and get you white? Yes, but it took off a layer of your paint, right? If you're a car, right? And you're getting down to the bare metal, if make a metaphor. And so I always caution people is that the things that say whitening and boost this are just super powerfully abrasive. It's like sandpaper. They're taking off that top layer. And it's like, oh, look, it whitened. It didn't really whiten. It just gave a new fresh and removed a fresh layer of something. So also talk about how that could be problematic with people who have restorations or porcelain veneers in the front of their mouth. Right.
So with porcelain veneers, the ceramics have a nice glaze that's been coated over the ceramics, so kind of like a clear coat. And if we use abrasive products, it could actually take away some of that finish, which could then cause ceramics to look more dull than they should be.
They're losing that shine.
Losing that shine.
It also potentially makes them poor. So when they're sealed from the factory, if you will, right? Not the factory, it's a lab. They have a glaze on them, which makes them non-porous, which makes them non-staining. So
non-staining.
If someone is at home using this whitening toothpaste, over years, that glaze gets abraded off. Now, does it open up porosity for staining?
May not open up porosity, but it will definitely change the color of the teeth.
Okay.
In the sense that a lot of the clear coat staining that we do, sometimes we also add characteristics into that. So we custom shade teeth with different colors and things, and so that it can remove that potentially.
I've had patients actually say they just don't feel like they used to. They don't feel as smooth or as shiny or whatever. And I'm like, what toothpaste were you?
Yeah.
And sometimes that's the problem. Sometimes it's not. All right. On this topic, what foods or drinks should I avoid for better oral health? For better oral health.
So we don't realize that almost everything that we consume is acidic.
You say acidic?
Acidic,
okay.
Yes. So the pH of most items that we consume, food and beverages.
Give me an example of a beverage that's bad.
Well, all fruit juices pretty much are mostly acidic. Okay. Sodas,
Okay.
Coke, Diet Coke, Coke Zero, Sprite, ginger ale, anything that's
What about Gatorades?
Gatorades are also acidic.
Okay.
And so
So pretty much everything that anyone likes is
pretty
bad
much
for their teeth.
Yep.
Awesome.
Yeah.
Awesome.
And so sometimes I'll if I see a patient that has, a lot of erosion on their teeth, which is where acid is kind of sat on the teeth or it's affected them and it's starting to thin the enamel, I'll ask them, hey, maybe it might be worth you studying the foods that you consume and the drinks that you have. Get some pH strips. Check the pH levels of all of these things.
What's a pH? What you put it? You test your saliva.
No, so you just put test in the beverage or whatever you're having to see. Like tomatoes are very acidic too.
You can get those on like Amazon.
You can get those on Amazon.
Interesting. Oh, so it's mainly. I'm guessing that mainly liquids are the culprit.
Mostly liquids, and especially if people are sipping on coffee, tea throughout the day.
But coffee's not bad for your teeth. It just stains them, right?
It stains them, but it is technically still acidic.
Really?
So that's where you want to be careful, because if you're sipping coffee all day, yes, you're going to have a lot of stain, but you could have potential erosion too. So if you're not drinking water in between
your sips
as
a neutralizer.
Yeah, as a neutralizer to remove some of that acid.
So look, we're not here to judge vices. We all have them, right?
I do too.
I know people in my close family that love a Mountain Dew from time to time. And I say, look, if you're going to enjoy that, can you please just gulp it with one swig and not sip on it and rub it around? So, all right. So you're saying that the counterbalance to that is if you have a beverage like that, to buffer it with either water. Does chewing gum help neutralize?
Certain ones. I would say even alkaline water is a great option.
Alkaline water.
Yeah.
So it counteracts
some of that
the
acidity.
Acid, the base. Got it. All right, that's cool. All right, I love that. All right, so what are signs of gum disease? Meaning that someone could detect at home. And I will ask one more clarifying question. A lot of times people think gum disease is like an infection. You think of a disease as something you can see. Like if I had a cut in my arm, and it was pus, I'd be like, okay, that's an infection. But a lot of times it's subclinical. You can't tell.
Right.
So is people have heard of periodontitis, they've heard of gingivitis, but are they the same? They're the same family, right? Meaning one's a precursor. Right. So talk about like what would be a sign of early stages of gum disease at home.
So one thing that you would notice is if it starts to hurt to brush your teeth, or if you start to notice any kind of bleeding while you're brushing, if the gums start to become more red in color and they feel potentially puffy, those are all signs that there may be something going on with the gum tissue. Because normal healthy gum tissue is bright pink.
Bright pink. Was it coral, they say? Isn't that the term?
Coral, roughly. Unless you have some pigmentation in the gums.
And interestingly, what it should look like, I remember this from back in the days, maybe this is in my dental school days, which is long before your dental school days, right? That was just a joke. He's not laughing. Is that it should look like the peel of an orange.
Yes.
It's what's that? Stippling.
Stippling.
Yeah, that's right.
Yep.
So it should look, if you've ever seen an orange, it has those mini indentations, right?
And it's firm.
And it's firm, right?
Yeah, it's not soft and squishy.
What about if you're flossing and it's bleeding? Like, oh, that's normal. It's always done that.
So I have seen this where patients, do have a little bit of redness or some gingivitis, and when they floss, they end up having lines in their gums from the flossing. So they still floss, but there is some gingivitis, and that means that they just need a professional cleaning to kind of help get things better.
Okay.
That's kind of a telltale sign. That,
let me ask it again then. Is any amount of bleeding normal?
There shouldn't be bleeding. There shouldn't be bleeding. Yeah.
That would be like me saying like, all right, I'm gonna floss my arm, and it's normal. It bleeds. I'm gonna scratch my arm and it bleeds. Like that's normal. It's always done that. That's
not normal.
Yeah. So that would be a sign. It's just a little pink in the sink.
Little pink in the sink.
Pink in the sink. All right. All right. So what are dental sealants, and why are they right for me or my child? First off, I've never asked your philosophy on a sealant, but so maybe you love them, maybe you don't.
I like sealants.
So first off, explain to everyone what a sealant is.
So a sealant is we consider it a preventative filling, and we place it in teeth.
Filling sounds like drilling.
So we're not drilling, actually.
Okay.
We're just placing like a lining in to block deep grooves in teeth. It's a plastic type material that we can cure with the light. But what it does is it prevents bacteria from getting into really, really deep grooves and potentially creating cavities over time. And so anytime somebody has really, really deep grooves in their teeth, it's kind of like a one-way trip for bacteria to kind of get down into these grooves. And once they're there, a cavity starts to begin. And so we know that if we block those grooves, we can prevent cavities from forming, especially on chewing surfaces and back teeth. In chewing teeth. And
how long does one take to get them done? Like per tooth? Like how quickly is this? An easy procedure?
It's a pretty easy procedure, and we can get it done while they come in for their cleanings.
I know a lot of these answers, but I'm advocating for all the consumers out here.
Absolutely.
One way of thinking about it is the tooth anatomically, if you look at it under a microscope, which we all had to do in dental school, it has these deep valleys, right? And so if you're looking at a microscope, now imagine here's the toothbrush bristle, right? And so sticky foods and things like that get wedged down in the valleys, these microscopic Grand Canyons, and then the brush just misses them, right? Mm-hmm. And then unfortunately, decay grows at that starting point, and then it grows downward and laterally, right, towards the pulp. Mm-hmm. And so what started out as something preventative, potential, right, is now turned into something that potentially is a root canal. So I put sealants in all my kids. As soon as their molars came in, I put them on because I think it's an ounce of prevention, pound of cure. I don't trust their brushing, especially when teenagers, you're getting in there, you can't do it for them anymore. And it's I think that's one of the best things in dentistry done well, right? And obviously it's a pretty technique sensitive procedure. So you want to go to someone who's done a lot of them or does it all the time, because believe it or not, it's like they can flick out if you're not done correctly because it has to seal the enamel. But it's I think that's one of the best things in dentistry is just, get your teeth sealed. It's so easy. It doesn't, there's no shots, there's no drilling. It's just, we put this on, we cure it, and we're done, right? So would you recommend, will your children have them?
Absolutely, they will.
All right, see?
Yeah, so, I had sealants when I was a kid.
Yeah, and you probably don't have a mouthful of cavities, I'm guessing.
I do not.
See?
Yeah.
All right. All right, so what is fluoride and how does it help my teeth? It's a little controversial right now, especially with, the new I forget his name, but the new health administration, but it's a little controversial.
Mm-hmm. So, the literature shows that fluoride helps keep teeth strong, and we've known
how.
So
I won't make you go too scientific, but what does it do?
So it helps with the mineralization, right, with the enamel.
Okay, so teeth are made of minerals, and so what is you're saying it helps with it, it changes the constituency.
So while the teeth are developing and being created before they actually bud, as well as low doses of the fluoride can actually help prevent cavities from forming too. Oh. So there's decay prevention and solid tooth formation. We do see problems though when there's not enough fluoride, or sometimes if there's too much fluoride, we can see white lines that form in the teeth. So obviously there's a lot of controversy because a lot of people believe that fluoride creates other problems. Right. So, in our practices, if somebody doesn't want to have any kind of fluoride treatment, that's okay. We have other options that are non-fluoride that, You
mean like a fluoride treatment, like the delivered here? Mm-hmm. So there's a difference between the fluoride we ingest, i.e. from the water source, and the fluoride you get at the dentist, right? And one is obviously it's going systemically and traveling through your kidneys and all the things, and you're getting in your bones and all that, right? And whatever, it's in the water, But the part that's delivered at the dental office is very concentrated. You're not ingesting it. It stays local. It gets absorbed by the teeth there. It doesn't get in your bloodstream, is what I'm trying to say. Mm-hmm. And then you're getting rid of it, right? So
you're not swallowing it.
Yeah. And especially if you're prone to, I had one of my children was prone. I keep talking about children here, but one of my children was prone to decay. And had a bunch of them. She had a little defect in her enamel. and upping the dose, it changed the game for her. It was really going to be her only salvation of prevention. So, so anyway, okay, keep moving on. All right, what should I do if I have a toothache or dental emergency? And I'm guessing you're going to say oil pull, right?
So, I mean, you're going to call us, right?
Got it.
You're going to call us if you have a toothache.
All right, so what are some signs of like some serious, oh, this is more than just, this is not going to go away, or this is definitely a need for a call to the dentist? Because sometimes I think people give it like, I'll just give it some time,
Yeah.
So when do you know it's time to like pick up the phone?
So if you're having any kind of aching pain when you're eating or drinking, liquids.
Well, liquids, people have sensitivity though, right? So like, that's not pain.
But if the pain lasts for, you could have an area, like say you had a filling done and part of the filling came out or something like that, and you had a little bit of tooth exposed, you could have some mild cold sensitivity there. Okay. But some people also just have cold sensitivity just because their teeth are sensitive.
But it should, normal cold sensitivity comes, ooh.
Yep, you feel a little zing.
But it doesn't linger for longer than a few seconds, right? That's a normal reaction.
That's a normal reaction.
If it were to persist for
over 30 seconds.
Okay, that's a problem.
That's usually a problem.
Okay. What about like hot stuff?
So yeah, I mean, hot or cold, really.
Okay.
And if you're drinking hot or cold liquids and you're having some sensitivity or some nerve sensation and it's lingering for any time period, that's something you definitely want to get checked out. If you bite down and you're chewing or you're eating and you feel something hurt on your back teeth, that's something you want to get checked out.
Right. So when you're putting pressure downward on the tooth and it's hurting, potentially that can be an abscess, and then it hasn't, because you're pushing pressure on that area of infection, which has nowhere to go because the bone, right? The bone can't expand, and so that's people ask me this a lot about that. I'm trying to think of any other kind of telltale emergency signs where you're like, okay.
You also for a lot of patients or people that they have jaw pain. So if they're grinding or clenching their teeth, they don't really realize they're grinding or clenching, but they start to get pain in their joints or their jaw. It could be the muscles that they're getting a little overworked.
They're working out all night long,
and
they don't know. We don't know.
Yep, exactly. So those are all reasons to want to at least have it checked out.
That's not an emergency per se. That just needs
some intervention.
Intervention. There you go. Thank you. That's the word I was looking for. All right. How can I protect my teeth during sports? Or what's the best way for that?
Yeah. So for contact sports, a sports guard.
Okay.
It's definitely the
grocery
go-to.
Store.
So the grocery store can make some. You can buy something that
boil
and bite. That's a classic thing that's been around for a really long time. We prefer that we make one for you that's custom.
Yeah.
And so it fits to your teeth very intimately, and the material goes right where we know that you need it. And so it's a nice custom thing. Yeah, it's custom made. So.
Okay, and then so what are the latest advancements? And this is something that people typed in on. What are the latest advancements of things that I should know in dentistry? And honestly, this could be an entire podcast. Actually, it could be an entire series of all the things that are in dentistry. I'm actually looking at some of the fancy things we have down in the ADS lab that are just state of the art with AI and 3D printing and all that. I'm not trying to steal your thunder, but don't go too deep, but like, what are some of the things that are the most exciting for you? And you're on the cutting edge, so like maybe reel it back just a little bit.
So there's a couple things. So there's cutting edge technology that helps us as providers within our offices, and then there's also cutting edge technology that helps the patients. And I think one of the biggest things that when patients come in and see us and we're able to explain to them what's going on with their mouths and different conditions and things. The intraoral scanner is probably one of the best things that we have. We're able to show people their mouth on a screen and rotate it around and show them the back surfaces, the front surfaces. Pull up the infrared camera and show them, cracks and potential decay areas and how the gums look and how the bite looks and how much pressure they're putting on one area of the mouth or another.
And it's really just it's like a high def camera that kind of
really
does a million photos in stitches them together and makes an image, right? And from that, you can get mouth guard, everything made, Invisalign mouth guards, preoperative stuff.
Yeah.
So that is cool. And I think there's a huge wow factor when you see your teeth like on screen in like a 3D image that you can kind of rotate around and look at everything. Has there been any kind of advancements in like AI and cavity detection? Like what's helped the consumer there?
So we use a software that helps us detect cavities and abnormalities on x-rays. And so it's kind of our second opinion as far as when we're going through x-rays, we're looking at the software is helping us highlight certain areas that we go and double or triple check to make sure, is there a potential cavity here? Is there something that we need to look at more closely? Is there a potential infection in this tooth?
Like a second set of eyes.
Second set of eyes. And so it really does help us as a team with the hygienist and the doctor and the patient. And patients will see something and say, well, what is that? Can you tell me a little bit more about that? And for us, that's great because it allows us to have a better conversation. Because patients
it's interactive
are more,
as opposed to like, hey, trust me, it's on your, just trust me. It's interactive. So, I mean, there's so many things as you're sitting here talking, Dr. Gandhi, about like things that excite you. And I'm actually thinking of like oral cancer screening, like there's, oral DNA testing that we do. I mean, there's so many things that are now forward facing for benefit of the patient, right? Well, no one cares about for the dentist right now, but like important and, that made a change for the consumer. So we've talked about, the intraoral, we've talked about AI. What else? Is there anything that's like super exciting that a person who maybe hasn't visited the dentist in 5 years would be like, what is this? Yeah. Can you think of anything?
I think one of the other things that has evolved over time, especially for us, the oral DNA test, the saliva test. It's one that now we can test for so many more things, not just bacteria that affect gum tissue. We can actually check for bacteria that cause cavities.
Yep.
And that's a big
cavities,
thing, like,
gum disease, right?
All that. So, and then we get a full report for, these bacteria are also seen around the heart, or these bacteria are also seen in this part of the body. And so it allows us to kind of tie everything back together, and it ultimately helps the patients be better caretakers for themselves.
Have you had instances where someone has taken that report and it's saying you have a dominance of this bacteria that we know is linked to this, and then they've taken it to their doctor and the doctor's been like, you know what, there may be a correlation here?
Yes. Not me per se, but there was a patient at our offices recently that another doctor was seeing, and they had the same situation. They were able to pick up something through a test that allowed them to actually get healthier because we were able to identify things that they didn't know.
Right. I think too, it's cool in the era of like, I think people are so used to testing, right? And so you look at like even the stuff you can get at home, like the function health or the levels health, like you can get a full blood panel of like what you've got going on, right? And people are into that. And I think testing became the norm, especially in a post-COVID kind of era. We're used to getting testing and knowing what it is. And it is nice to get that report that shows you like, what are the constituents of what's going on in my mouth? Because no longer science tells us, and we used to think it's like, oh, this is my mouth and this is my body. And no longer, you think about it, if you have a bunch of bad bacteria and you're having a full meal, they're going all through your body. And so knowing what your saliva and your mouth consist of, I think is a vital part. I think that's a really cool thing. And then knowing and then having a provider that knows what to do with that data to fix it. That's the big thing. So a lot of offices don't test because they unfortunately may not know the action to take from that point forward.
Right. Yeah. It's I've thought about this recently, but in America, let's just talk about America. Dental care is really pushed to be preventative.
Okay.
But when you look at medicine, you don't see
it's sick care
as much preventative care.
Right.
And so kudos to the dentists in America for really pushing preventative care, because we're helping people see how can they prevent other things, and we're trying to help that push that correlation of, listen, and like you said, testing and social media is great. It's also sometimes it can be too much, but it has allowed for a lot of people to be able to see what they can do. Like, people are more aware
I see.
of the fact that, hey, like, you can do this testing, or you can do that, or you can do this, or you can take charge of your own health.
You can be your own advocate, for
Be
sure.
your own
And knowing-
advocate.
Yep. And even like oral cancer screenings we have, I'm just thinking there's so many cool things. And yeah, it just keeps getting better and better. All right, I think that's a good wrap. Like I said, we could talk about the advancements in dentistry and the advancements in materials, the advancements of science stuff, but I think we would lose all of our listeners. So let's wrap there. If you want to find out more, definitely check out the website. We have copious amounts of information on all the things, and we'll see you next time. Thanks, Doc.
Thank you.